Okay, we're going to be doing implant training and how to go about a consultation visit, an impression for a surgical guide, everything in general in regards to implants and getting prepared before the actual surgery date. So in order to find all the forms you need, all of them, you're going to go into computer, then follow up into going into documents, S drive, followed by finding all the folders that are in alphabetical order. Look for implant info, and everything is inside of that folder. And it's organized by assistant information, patient information in regards to what goes scanned into the patient's chart. All those forms are in there, as well as surgical guide information. The first form is an order form. This typically comes from admin. It usually comes from either someone who scheduled a patient for an impression up front, given the green light from an oral surgeon, or it is planning for a surgery we're doing here and we need to make sure we have all the parts. Okay, so typically date of request, they fill out who it's coming from, all the information needed that we know who to address, say if the delivery of the package is not going to be upon the day that they were scheduled. So everything should be filled out in here, no blank spaces. Okay, next sheet is the consultation form. I don't care what you do, but that appointment where you're consulting with a patient about getting an implant done here, this must be filled out. If this is not in the patient's chart, we cannot move forward until we have this sheet filled out. So this is very, very important. It says implant consultation form. Okay, you're going to have your basic patient information, but what's very important is we need to know surgery date. When are we planning on scheduling? Because we must know all the parts that we order as well as the surgical guide that it will be here in time. We need to know when we took the 3D scan. Say if for some reason the name was misspelled in the computer, we can at least search the patient scan through the data it was taken. With this being scanned in the patient's chart, we'll always have that. Okay, so very important. Same with the last sheet, everything must be filled out. No blank spaces, even if you have to put not applicable, do that. Okay? In regards to these yes or no questions at the consultation form, if you don't quite understand them, that's fine. Just make sure Dr. Baker sees that and says yes or no to them. Because typically with this question here about the 2mm keratinized tissue, if we don't have that, we can't move forward. So it's something that must be circled yes before the patient leaves our office. So always, such as any consultation form you do with Dr. Baker, you always make sure everything's filled out accurately before the patient leaves. He can sign it at the bottom if he would like to confirm that. This box, don't worry about this. This is going to be filled out by Dr. Baker, and the person who will order parts according to this box is given to the assistant who does order the parts. So don't worry about this. Fill out everything here. Next paper, we have implant consultation form as a sample. So I filled out one as Jane Doe, it has a surgery date, answered all the questions here, pretty much essentially what I went over, just an example of how it's filled out. Next very important sheet is something that you will find in sterile, unless the locations move, but for now it'll be in sterile on our pin board. This is like a tracking sheet, so we know what step was done in regards to knowing if a patient's ready for surgery or not. If all of these say no, if one of them say no, we are not ready. And say if the patient's scheduled tomorrow, one of these says no, we must figure out what to do to fix that. So for example, we have Jane Doe. We took impression for surgical guide. That's done. The surgical guide, ClinCheck. I say ClinCheck because it's kind of like Invisalign where you approve the case so they can send it out. We'll say that's done. Let's say Jane Doe's scheduled tomorrow. Her surgical guide's not in yet, as well as the implant parts. We must reschedule that patient if that's the case. So if a patient is scheduled tomorrow and any of these say no, must reschedule. So this is a great tracking list for a quick view of Dr. Baker if he wants to go into sterile and say, hey, where are we at with Jane Doe's case? Let me look at this sheet. We're not quite ready. So he'll know off of this sheet that's visible for everyone where we're at. Next form. Whenever you take an impression for a surgical guide, a paper, just like any Invisalign, any type of prescription needed, obviously the company needs to know whose impression that is. So they have a well thought out, impression stone model submission form that you need to fill out the doctor information, all of our office information, the patient information, and you must select the tooth number. With that, it goes in the box with the impression. Please know that the impression that you're taking is only on the arch that we're placing an implant with. You don't need to take an imposing, you don't need to take a bite, and it will be taken with VPS material, no alginate. And when you send them the model, it's strictly the model. We keep the impression here just in case the model breaks upon the shipment process. We can pour up a new one, no problem. So only send them the stone model. Very important. In the surgical guide folder, you'll also find some information where if you're new to this whole process, this should answer some questions for you. The login to the website, how to retrieve a scan from the computer, or fail-safe, just call Anatomage yourself and have them walk you through your first one. They can assist you on how to attach it onto the website. They'll log into the computer and show you how. As well as there's another paper in that folder as well that gives you a reminder that you must have the 3D scan of the area of interest, taking a PVS, do not take with alginate. There's an address on there. So all of that information is in that folder as well. Now, please keep in mind for the folder that says patient information, we do have to have them fill out a separate health history form. There might be a couple repeat questions as to the general health history, but with this one it's a little more specific to the standards of implants, what can cause failure, just make sure that they fill out everything, and if they have questions that you're in the room to answer if needed. So usually with the consent and the health history, we've made the protocol of having it done in the room where someone's there to answer questions, who's knowledgeable of the situation. And if you can't answer the questions, obviously, approach Dr. Baker. We don't want to leave patients feeling confused and not knowing what's going on. There's also the consent that needs to be filled out. They can initial each line. Make sure you put the chart number on there. It's just a regular consent before any type of surgery. We always require one. Post-op instructions. Rule of thumb for post-op, if you don't quite understand what risks to take or what to go over with them, just read it through it with them. After the procedure, before, however you want to do it, just make sure you hit every single line and you go over the post-op with them, because there can be risks of implants. It's an expensive thing to fail. It's not just a dry socket. So very important that they follow these rules. Day of surgery. Day of surgery, we have a surgery tracker. The implants come with a sticker that has a reference number and a lot number. Very important to have per patient for if there is a recall. A recall is where the company has had issues with such implants or whatever it may be, and they need us to contact those patients that had that lot number implant so we can call them in, and if it's that bad, we might have to replace the implant. So with the surgery date, we have this form that makes sure that we know exactly what we did that day, as well as leaving a space to put on that implant sticker from the box. So when you're cleaning up a room, just make sure you take one of those stickers before you throw those away, and it goes on this sheet. This gets scanned into the patient's chart. You just fill out from the top to the bottom. Again, as any form on here, you got to make sure everything's filled out. Do not miss anything.